Working for you. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts Nevis government. Join host Lesroy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for You is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for You.
Pleasant good afternoon to everyone who's listening today. Welcome to this edition of Working for You. It's a program that's brought to you by the St. Kitts Nevis Information Service, and the program intends to keep you updated on what's going on with the different departments and the units within government and their agencies. So today we are talking about a very important topic. And just in case you're wondering what happened to the regular host, my name is Jacqueline Bryan. I'm filling in for Mr. Lesroy Williams, who would usually host the program. He's taking some well-deserved rest, and it's a pleasure for me to be here with you today. I'm joined by persons from within the Ministry of Health, and we're going to be speaking about mental health and mental illnesses, but not just mental health and mental illnesses in a very broad manner, but as it relates to young people in particular. So like I said, a very important topic today. So I have three very special guests, and they are Dr. Hazel Laws. She is the Chief Medical Officer in the Ministry of Health. I'm also joined by Cheryl Amri Isaac, who is a nurse. She manages the community psychiatric sessions. So Community Psychiatric Nurse Manager. That's the correct title. Dr. Sherilyn Ward Crawford. She is the clinical psychologist here in the Federation. And we expect to deliver some very, very interesting and important information, and also information that you can use to help young people in identifying whether or not they have mental illnesses and how they can access help. So, welcome. Thank you for joining.
Thank you. Thank you for having me.
Now, prior to the show, I know we had a very robust discussion. Hopefully, we can convey the excitement we had with the listening audience. But this show is being held some weeks after we celebrated World Mental Health Day. So we can start by talking about that World Mental Health Day. You can tell us about the theme and what really is the purpose of the occasion.
Okay, good afternoon, listening audience. The theme for World Mental Health Day for 2018 was designated by the World Federation for Mental Health, and it's young people and mental health in a changing world. And the purpose of this annual day or event is for all stakeholders working in the area of mental health to talk about their area of work, their roles in stimulating advocacy, promoting mental health, and what more needs to be done to make mental health care a reality for all those in need in our communities, in our region, and worldwide. And so the day was celebrated about 2 weeks ago, on October 10th, in all parts of the world, not only St. Kitts, and it was all parts of the world.
So the theme was young people and mental health in
in
a
a
changing
changing
world. And today we are focusing on young people and mental health in a changing St. Kitts and Nevis, because that's very important. That times have changed, and with a change in times we have different situations and environment that affect people differently. So why focus on young people this year?
Okay, well, this year we are focusing on young people because it's an important target group. All right, so let's begin by understanding the definition of youth. Based on the United Nations, the period of youth refers to the period between about 15 years and about 24. All right, and so it's a critical stage of life. It really falls between childhood and adulthood. And if you were to pause and reflect, there are a number of things that happen or occur during this phase of life. The young persons change schools, so they may be going from Washington Archibald High to the CFBC College. Some leave CFBC and they're going out to college or university in a different country. Some will be leaving their homes for the first time and traveling. Some seek jobs, so they are in search of work. And so that's often a challenging period of life. Others, they find a mate. Some even start a family during this phase of life. And so this phase of life is characterized by a number of changes and transitions. And you would say that most young persons go through or traverse these changes without any problems. They cope. And that may be because of the environment in which they are living. They may have a good, strong family support mechanism, and so they cope. But a number of young persons, they don't cope well with these transitions. And if they don't get help and the support they need, they can go on to develop mental illness. And so that's why this year the focus is on the youth, because we want to increase the awareness about young persons and what they are at risk for in terms of mental illness, and how can we help our young people to mature and become resilient young adults who can go on or mature to contribute maximally to their families, communities, and society on a whole.
And it's important because they're
Yes.
going to become adults later on, so you want to pick up those kinds of things early. So what did we
The
do?
youth is the hope of our future, and
Yes.
that's why we are focusing on the youth this year.
So what did we do in St. Kitts and Nevis to commemorate the occasion?
We had a week of activities, and we started out on the Sunday, which was the 7th of October, with a church service at the Antioch Baptist Church with Pastor Lincoln Connor. And he did a really good job in terms of speaking on the role spirituality plays in mental health, because sometimes people think that when you have a mental illness it's because you have poor will, you don't have enough faith and those kind of things, and it's not necessarily that. And while we do appreciate miracles and things like that, psychotropic interventions, psychotherapy and counseling, all those have its roles. So he did a very good job in terms of speaking about spirituality and mental illness. After that, we had several radio programs. We had Dominion Radio. We have Michelle Delacote Blake. She did a presentation on Dominion Radio. We also had presentations on Freedom FM, where we had Nurse Coffee, who is assistant nurse manager in the community psychiatric nursing system. She, along with Dr. Archibald and myself, we did a presentation. And one of the key things that we had were two things that was very good for us this year. We had a patient treat, but it wasn't the normal patient treat that we have, where we just have a little lunch and things like that. We had some relatives who came along with us, and we had games. So we had the board games and we had outside games. So apart from eating and enjoying a good meal, we had a lot of games, and the families and the staff from the Mental Health Association and the staff from the treatment center, I really want to thank them, because they were the ones who hosted us that day. They really put an effort into making the event a success, and we had a fun time. Another important thing that we had too was what we call a presentation with the students from the Bastia High School. What happened, the Mental Health Association, we funded a film where we had some Bastia High School students. They did a film. They really did a lot of work because they did some research and they discussed the topic and came up with a film that was called Speak Your Mind. So beforehand, they did this film, and we were able to get about 100 students in the high schools around St. Kitts to come and view this film. So we had a screening, and we had quite a robust discussion about the film and the factors that can contribute to mental illness, and looking at some of the key things that came out in that film in terms of depression and how persons could seek help. So that was something new we did this year, and it was very successful. The week was really aimed at bringing awareness, mental health awareness, to the Federation. That's what we wanted to do, and I think we had quite a good job. So we did quite a good job. It was quite successful, and I really want to thank the team, the Mental Health Association team, the Vice President, Mr. Jacob. We had Miss Sam, the PRO. We had Michelle Delacote Blake, she's the Secretary. And we have Hillary Ferguson, she is the Secretary. So we all work together to make this a success. I really want to thank the nurses too, because they came out on the Sunday for the church service. They really came out in their numbers and they came out in their uniforms. So I want to thank the matron Daly Finley from the Josephine France General Hospital for partnering with us and supporting us throughout that day.
Fantastic. Well, at least we know that there's a lot being done, not just here on this radio program, but on the ground to bring awareness to mental illnesses and mental health. And I think that's the main purpose of observances, international observances. It gives us
Increase
an opportunity,
awareness, of course,
to
yes.
push at least for that day and that week
yes.
and raise awareness as much as possible.
And
Well,
try to reduce stigma. Because as you know, there's stigma associated with mental illness, and that's one of the other aims of programs like this and activities, as you just heard, is to reduce, help to educate and help reduce the stigma associated with mental illness.
Yeah, we're going to address that a little later on in the
Yes.
program and try and bust as many myths as possible that people might have. But before we get to that, let's try and help the listeners understand what your mental health is and what mental illnesses are.
Okay, mental health is defined as a state of well-being in which every individual realizes his or own potential, can cope with the normal stresses of life. That's a big thing for the youths, not able to cope, right? And can work productively and fruitfully, and is able to make a contribution to his or her family and community. So that is the definition of mental health. All right, and there need to be coping mechanisms, and can cope with the normal stresses of life. So that is mental health in a nutshell.
So mental illnesses now.
Mental illness, on the other hand, refers to a wide range of mental health conditions or disorders that affect your mood, your thinking, your behavior. And examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders. People mightn't think that this eating disorders is a mental illness, but it is a mental illness. And addictive behaviors, substance dependency behaviors. And many people have mental health concerns from time to time that might not meet the diagnostic criteria for mental illness. All right, so mental health problems range from worries we all experience as part of our everyday life to serious long-term problems. So mental health and mental illness are really determined by multiple and interrelating biological, psychological, and social factors. So mental health problems and mental illness can affect any one of us. It's a very thin line.
Sounds so.
And it doesn't respect anybody, it can affect anybody.
It can affect
anybody can be affected.
At any age.
Okay, so
Yes.
here's the first myth that we're gonna bust, right? That you have to have a weakness in your mind in order to get a mental illness. You have to be born with a weakness.
You can't just have
Not
that.
everybody can get it.
Because as the nurse was saying, the causes are biological, psychological, and social. Okay?
And genetic. You can
so-
have a genetic
So
predisposition.
under the biological,
So
we
it's-
have the genetic predisposition.
Mhm.
We have persons might even get in an accident, damage part of the brain, and they end up and have some sort of mental condition. And certain medical conditions too
Yes, right.
can
Put you at risk.
provoke these
Yeah, put you at risk for developing a
conditions.
mental illness.
Yeah, so it's a continuum, it's a continuum, mental illness and mental wellness, and so we have to find a balance, that balance between.
I believe this program is going to point out things to people that they didn't realize or about themselves or maybe about people around them or their loved ones. So hopefully they'll really be able to benefit from the program. And we'll allow listeners to call in a little later. I'll give you the phone numbers and I'll tell you when is the time to call. So what are some of the mental conditions and illnesses that affect young people globally?
Alright, so based on the literature, adolescents and young persons globally are prone to depression. Depression is a significant mental illness that can affect young persons, can affect anybody, but can also affect young persons. Young persons seems to be particularly at risk for developing depression. As I said, it's significant and it's really marked by sadness and loss of interest in things you used to like to do, and And so we need to be vigilant. Those of us who are parents and guardians, we need to look at our young persons and try and, pick up those that are at risk for depression. Now, as you know, severe depression can lead to suicide. And again, the literature suggests that in 2016, suicide was the second leading cause of death among youths 15 to 29 globally. The literature also goes on to suggest that as many as 800,000 persons can die of suicide each year. So it's a significant problem. And then harmful use of alcohol and illicit drugs is also another major issue impacting young persons globally, and regionally and locally.
Well, this is another myth, because there are people who would say that here in St. Kitts, our young people don't suffer from some of those things. For example, suicide and self-harm. We might have young people who say they're stressed. You constantly hear people, young people saying, so stressed out. And all the people are like, really? What do you have to be stressed out about? So how do some of the conditions and illnesses we are hearing about affecting young people globally, we see here, right here in St. Kitts and Nevis, affecting our own young people?
That's so true. Because when you look at the literature coming out of our mental health services, meaning the psychiatric ward at the hospital and the mental health clinics, when you look at the data coming out of the Health Information Unit at the Ministry of Health, all adolescents are impacted mainly by schizophrenia and depression. So yes, depression is also a condition that impacts our young people here in the Federation of St. Kitts and Nevis. And then you mentioned, interestingly, suicide. You may not have heard of a case, a successful case. However, in 2017, based on our data, we had 7 attempted cases of suicide, 7 attempted suicides. So they weren't successful. And interestingly, the age range of the persons who were impacted, their ages ranged from 15 to 30 years. So again, the young. All right? And then substance use, substance dependence is also an issue amongst our youths here in the Federation.
Well, the substance abuse, I think some of us are aware of, but I'm sure there are some people who really gasped when you said we had 7 attempted suicide incidents
in 2017
here, and we see people as young as 15
15 to 30
harming themselves and trying to take their own lives.
Yes.
So that's cause for serious concern. So that what then are some of the changes that have been taking place in St. Kitts and Nevis, some of the changes in the way we live and interact with each other that have been affecting our young people?
Well, we know technology. We have advanced quite a bit with technology. When we were growing up, we didn't have the internet, we didn't have the cell phones, so we didn't have social media and things like that.
But aren't these things intended to make our lives better?
They do. They
So
improve
true.
communication.
So true.
However, there are so many social media platforms, Instagram, Facebook, what are the others?
Twitter,
Snapchat and all of those.
Yeah. And instead, because it's meant for good, but sometimes we have persons who use them for bad. So we were supposed to enjoy social media, connect with friends, have fun, but then we have persons using it to bully other persons on social media. And apart from that, what we have developing now is what things like we call cyber sex addiction. This is the compulsive use of internet pornography. We have things like cyber relationship addiction, addiction to social networking. Sometimes you're not looking for anything. You're just browsing from page to page and you're on it for hours. We also have net compulsions like gambling and gaming. And we also have computer addiction in terms of games. Sometimes we have these violent video games that they are playing and all sorts of computer games, and it's like it overloads people, so they use it excessively, and it could cause mental problems for them because it could go into addiction. So it was meant to be for fun.
So one of the things that I observed as well we talk about social media, but even with the cellular phone, right? I observe that a lot of young people, they do a lot of selfies. And I'm wondering, you see them even walking across the street and they're taking selfies, and I'm wondering if it gives rise to their self-image, right? And that could pose a problem. Because if they think that they don't look good or whatever it is, I wonder if that is so. Or it probably gives rise to like narcissistic behavior or narcissistic personality.
Issues with self-esteem,
Yeah, right.
self-esteem issues,
Self-esteem.
and could be a source of depression if they're not able to manage it properly. Another thing that I've noticed is that there are a number of younger persons, children, and young teens who spend hours on video games and on the various social media platforms, as opposed to a young person who would engage in football or netball or tennis and interact with other young persons physically. All right, and so there's a big difference in terms of having a relationship with a friend virtually and sharing emojis, as opposed to going down the road and interacting with Sheila and talking and developing a closer bond. All right. For example, right now there is a network of men. They're about in their 60s, and they were friends for life. They played football together for about 6 years, and that bond has lasted a lifetime. Now, I'm wondering, the young persons, they're not doing that. They're not going out and engaging. I mean, some of them, a cohort of them, they are more involved in social media and how many friends and likes, etc. I'm wondering the quality of those relationships and interactions. How long lasting will those relationships be? Because as you know, as you go through life happens. There's the death of your mom, your dad, a spouse, a loved one, a friend, an accident that is very traumatizing, and you need a social support network to help you through these situations, because if you are not able to cope, you are at risk for a mental illness. And so social media has its positives and its negatives, and I think we need to the younger persons need to strike a balance between the time spent on social media and the virtual relationships versus real face-to-face relationships. So these are some of the changes that we are noting in our federation, in our region, and globally.
So you would find one person might have 920 friends on social media.
I've seen people with over 1,000 friends
on social media, and they don't have one person
they can call
talk with face to face.
Yeah.
Okay.
And
that is not good, because and it just shows how communication has changed too. Because as Doctor was saying, we're using the emojis, we're doing the shorthand text that it seems like we have to go back to school to learn, because sometimes somebody sends something and you don't even know what it means, because it's all these abbreviations and things like that, and people are not facing each other and expressing how they are feeling. They just send a picture and that is it. But persons need to be able to recognize facial cues.
I can play the devil's advocate here.
Have you ever been to a restaurant and you see four persons around a table and there isn't any interaction? Everybody's just on their individual phones.
And they might be celebrating a birthday or anniversary or some family get together, and everybody
I was going to play the devil's advocate and say that when we speak about social media in particular, when you look at services such as WhatsApp and Facebook and Snapchat and whatever else is there, it allows you so many different ways to express yourself.
Yes.
There are so many different emojis. There's practically an emoji for the way I'm feeling right now, or the way I was feeling this morning, or if I just got some really exciting news, or I'm not feeling too upbeat. So it allows you these different mediums and platforms to express yourself. So how can having all of these different mediums to express yourself, you still find people having superficial relationships and maybe not utilizing them properly?
This is the concern I have, okay? the children younger and younger as they go, they are using these Facebook, well, not Facebook, all these gadgets and things like that, okay? And while lads, they may be able to enjoy a program on the computer, which I do believe, because they could have educational stuff. What is important for children to be able to do is to recognize facial cues. And there is no emoji or anything that's going to help you to recognize facial cues. I'm supposed to be able to look at you and make it say, she look happy.
Or she's sad.
She's sad. She look a little worried. Or things like that. And if they're going to be on the internet so much and communicating so much with these emojis, they're not going to be able to recognize, how people are feeling by just looking at them.
And that's something we
There
definitely
is
learn
no
in communication.
comparison between a real smile, as I'm smiling with you, compared to an emoji. There's hardly any comparison.
And like I said, that's something you learn in communication. That
Yeah.
communication is just what you say, but like you said, the cues,
Your
your
body
whole
language,
body,
yeah, you
you're
speak with your
communicating.
body language.
Even when you think you're not communicating, you're
Yeah.
communicating a message.
And people supposed to be able to express themselves, and I don't think the picture or the emoji helps you to say, this is how I'm feeling today. I'm feeling sad. I'm feeling a little worried. I'm feeling, they don't get to practice that, and they're supposed to be practicing that as they grow up. And they're
As
missing
an
out on
important
that.
part of social interaction.
Yeah, as a
Yes.
social
And then
part.
when you think
Important
about
part.
mental illnesses now, you really need that strong social support, good friends. That you need. Each of us, we are social beings, and we need a healthy network of family members and friends, church sisters, church brothers, to provide us that emotional support, sometimes instrumental support, that is required as we go through life.
And Dr. Laws, you had mentioned something in our discussion prior to the show about face mask, hiding behind. You really feel one way, but you communicate something
In
else. So
another way.
people don't really understand how you really feel.
Yeah.
It's easy
Yeah.
to use these emojis
Yes.
to hide behind
Yes,
them.
yes.
So people don't know when you're hurting, they don't know when you're sad, especially if they don't see you. They're
That is
depending
so
on
true.
whatever you send to them, and it's
Yeah.
really easy to.
So basically, you can have a younger person, even in your house or even in your classroom, and superficially, that individual may seem okay. They may be smiling, but deep down, there is a sadness that's behind that face mask. And so we want individuals, persons like teachers, guidance counselors, parents, aunts, uncles, family members, to be aware, hey, a younger person may be in need of help for a mental condition right under your nose, and you may not be aware of it. Yeah, so you need to look behind that face mask. You may see a smile, but when you really sit down and have a one-on-one, that same young person can burst out in tears and then pour out the issues that they may be trying to cope with, but they are not getting through.
So that comes to capacity training and capacity building amongst the guidance counselors, because and parents as well,
Yes.
right? Because most of these behaviors are seen in the home and in the school, So we have to have some workshops for guidance counselors, for parents, for the teachers to recognize these masks, as Dr. mentioned, and see we can have early intervention as well and treatment.
Yeah. So that they can be channeled to care.
Is
Because
that-
care is available.
Is that a service that the ministry offers? If there's a group of, say, coaches or church leaders want their youth group coordinators to get that kind of training, so
That
they
can
can
be
That can be
arranged.
arranged, yes.
That can
That can be
easily be
arranged.
arranged. That can easily be arranged.
And and there's the risk factors. There are the risk factors as well, like early introduction to alcohol and drugs, as Dr. Laws said, defiance, aggression, family violence, negative peer pressure. That's a big thing amongst the youths, So the risk factors play a great part in it as well.
So we've identified some of the mental conditions and illnesses that are affecting young people, and some of the conditions under which those things are exacerbated. So are young people getting the help they need and accessing the services available?
I don't think that they're getting the help that they really need, you know, because I think some of the parents are also in denial, apart from the stigma that's attached to mental illness. I think a lot of the parents are in denial as well. You know, my child doesn't have a mental illness because people are going to label them as crazy, you know, and so they're reluctant to probably to bring them to the clinics. You know, on a Thursday afternoon we have our mental health clinic, because on a Thursday afternoon that is where all the quote unquote crazy people come. You understand? So I don't think they're accessing the clinics
But
as they ought to.
some are, because when we look at the data coming out from the various mental health service points, for example, the JNF General Hospital has a psychiatry wing. When we looked at the data over the last 2 years, 2016, 2017, in 2016, 17% of the patients who were admitted were under 25. And in 2017, 23% were under 25. When you look at the data coming out of the community mental health clinics and the number of persons who access care between January and September of this year, about 5% of the cases were under 25. When you look at the data coming out of the Mental Health the Treatment Center, between January and September of this year, we've had a number of cases of drug use, drug dependence, and about 18% of the clients were under 25 years of age. So yes, some of our youths are accessing the services are available, but we really do not think that we are reaching all of the young persons who are in need of the care that they should be receiving.
Well, let's talk about what are some of the services available to them so that people can be more aware. What are some of the services and where can they access them?
Okay, as I said before, I mentioned the JNF General Hospital Psychiatry Wing, which is a 12-bed facility. I say 12-bed reservedly because the capacity can be expanded as the need arise. All right, and then there is the Dr. Arthur Lake Mental Health the Treatment Center, which was opened September of last year. It's located in the Limekeel area, and that center really caters to patients who would have been discharged from the psychiatry unit, and so they are no longer acutely ill, but they may not be ready to say even go back out to work or be referred to the clinic. And so they will be referred to the Mental Health the Treatment Center. And so at this center there are a number of programs that such individuals can be enrolled in, and it helps to rehabilitate them. It helps them to reach their fullest potential so that they can go back out into the community and make meaningful contributions. So some of these programs include exercise, occupational therapy, recovery journaling, substance abuse counseling, meditation. They are also exposed to group therapy and family counseling, and there's availability of individual counseling also. Some engage in agricultural practices, and so there are a number of fruits and vegetables coming out of the Mental Health the Treatment Center from their agricultural program, so it's quite good. There's music appreciation, nutrition, sporting activities, so they are encouraged to keep physically fit and active, cinema therapy, pastoral care, reading. There's a reading program and a social skills training program. Alright, so we have, as I said, the psychiatry wing at the hospital, we have the Mental Health the Treatment Center, and we have 5 mental health clinics in the Federation. So in Nevis, we have a community mental health unit or clinic, which is located on the compound of the Alexandra Hospital. We have fortnightly clinics at Her Majesty's Prison, and there are 3 health centers where persons can access mental health care. Bastia Health Center, Molyneux Health Center, and the Sandy Point Health Centers. And I'll ask Nurse Amri Isaac to expound explain a little bit more about the mental health clinics.
Okay, as Dr. Laws mentioned, every Thursday afternoon at the Basta Health Center, we conduct a mental health clinic every Thursday afternoon. There is an appointment system in place, but we also accept walk-ins. Anybody who want to access or they have a problem, they can always walk in. We don't turn anybody away. And so what we do there now, we assess the client, the new client. We do a mental status examination, and it's very detailed. We take medical history, family history, working history, very, very detailed. But so between the mental status examination and the history, we are able to know a lot about these patients or clients. We do not counseling and not much counseling because we refer to the counseling center, we refer to Dr. Crawford and to the counseling center where Mr. Dr. Lake is. And we refer to appropriate services as well. All right, maybe to a medical, they might have a medical problem because we're doing holistic care, and so we refer to surgical doctor, medical doctor, and that sort of thing. All right, so anybody can come in. And so on Sandy Point, we have once a month, and Molyneux is once a month as well. And we do the same thing, assessments and history taking. Right, so.
There are two counseling services. There is a counseling service at the JNF General Hospital, and then there is a counseling center that operates under the remit of the Ministry of Community Development, Gender Affairs and Social Services. And I think Dr. Crawford can expound on what happens at these counseling centers.
Yes. Basically what we do mental health assessments. Okay, so that could include screening, where we do testing for ADHD, we do testing for anxiety disorder, bipolar disorder, depression, any mental condition you can think of, we do screening for them. We also do it involves a complete psychiatric history from birth, even before birth, while we were still in your mother's womb. We want to get a good history, because sometimes when the parents, if they have any medical condition during pregnancy, it can affect the baby too. So we do a complete psychiatric history, and we offer counseling and psychotherapy. Apart from that, we do psychoeducation. We educate persons about different mental disorders, and a key thing that we started doing too is involving family more, because over the years we realized we were getting quite a lot of students, and parents had the mentality, okay, fix them. Okay, they send them to be fixed, and they don't realize that the environment that they are in at their home could be contributing to some of the issues that the children were facing. So each consult, we tend to ask the parents to come along, and sessions last an hour, but we dedicate 15 minutes to the parents alone, where we talk with them, get feedback, see what they are trying, how it's working, and we give them some tips as to things and techniques that they can do in their home to help us and to help their children to be more productive and to overcome some of the behavioral issues, or to overcome some of the psychological distress that they have been having. And I want to note too that at the hospital we have the social worker, Miss Martin, who has been very, very instrumental with working with these children, because we have a program that involves connecting with the schools too, because a lot of times we get the referrals from the school and we don't want it to be just a drop off by us. No, we have to work together. So Miss Martin, as the social worker, she gets feedback from the guidance counselor, especially when we have persons with behavioral issues, because we will want to know, okay, is the person attending school, what kind of feedback the teachers are giving about the patient and things like that. So we have the social worker very instrumental there, which is good. And we work along as a team, because we're in the hospital setting. We have persons who might have medical conditions, who might have some sort of psychiatric problem also. So we have to work along with the specialists, if it's from surgery, from medicine, from pediatric, even from maternity. Because, sometimes we have persons who would have had a miscarriage, or persons who might have given birth to babies who have some sort of deformity or defect, anything like that. And we work with them to make sure that they're able to cope with these conditions?
The St. Kitts Nevis National Council on Drug Abuse Prevention Secretariat also provides services in terms of substance use and dependence. And then there's the Mental Health Association.
Yes, and
Yes.
we because we did the week of activities, and as we say, it's more geared towards awareness. But we are hoping in the future if we can get into maybe research and things like that, that would really help to guide decisions that we make in the future. It will be very good. And I just want to add also that in each school we have a guidance counselor. Which is a plus. In each high school, some schools have two depending on the population of the school, and each primary school has a guidance counselor attached to them also. So this way they're able to pick up
those
you know,
at risk.
Those at risk quickly.
And they make the necessary referrals to the various agencies, either the mental health clinic or the counseling unit.
centers.
Yeah.
So when a young person or a parent wants to, or someone else wants to access the service on behalf of someone else, is there a process they have to go through, or can they just walk into? I know you said that the Bastia,
Yeah,
the clinics are walk-in.
You can just walk in.
But are there any others that are walk-ins, or
Anybody who is in need of mental health care, all they need to go to is the nearest health center. That's all. The nearest health center within your district, you just walk in and care will be provided. Because then you'll be referred to either of the mental health clinics or the mental health treatment center or the counseling unit at the hospital or at the other counseling unit based in Greenlands. And there's also counseling that is available at the mental health treatment center. Yeah.
where referrals are concerned, how important is it that someone be referred to the most appropriate institution or clinic or place, whether it's in a workplace or the school?
Okay, so it's the referral is easy because I think most health professionals are aware of the referral system. Again, if you're in a workplace setting and there is a worker you are concerned about, you can make a call to the nearest health center. You can call the mental health treatment center. So it's easy. Once you make contact with a health professional, the rest is done.
Yes, we
Yes,
get
it's
referrals.
quite easy.
Yeah. And we do referrals among ourselves too. So for example, if I see a patient and I think that this person would benefit from some sort of psychotropic intervention, some sort of medication, I would know, okay, the person to call or to refer to work along with me is the psychiatrist, because medication alone is not going to work for patients. It's a collaboration, the medication and the therapy. That works best.
Counseling and psychotherapy.
Yeah, so we do get referrals from not only the doctors, but nurses as well. You know, self-referrals, friends.
Yeah,
Friends as well. You know.
So the key thing is to recognize an individual, a family member, a loved one who you may have noted a change. They become irritable or agitated or boisterous, and they may be at risk of a mental problem or illness, and it's to direct them to the care that they so need.
I get a feeling the answer to this question is no, based on what we said earlier. But I'm going to ask anyway. To what extent do you think the young people who need these services are accessing them, and how can we change that?
Well,
If it is a no, and if it's not very many.
how can we change that? I mean, by doing more awareness campaigns, more shows like this, because persons need to recognize the signs and the symptoms, as Dr. Laws just mentioned, of a mental illness, a behavior change in the youths. All right, so more awareness campaigns.
I think the specific answer to your question is no. I don't think that we are reaching all the young persons who are impacted by mental illness because of stigma. Yeah, I think in our society There is still some persons who may know that they need help, but they are fearful of accessing it because of stigma. There is an association between mental health and you're being weak, not able to cope. Persons don't realize that a mental illness is similar, well, not similar, but it's a condition like any other physical condition, and it should be treated equally. Yeah, there shouldn't be disgrace associated with a mental illness as opposed to diabetes or hypertension. All right, and so because of stigma, I don't think we are reaching all the persons, all the younger persons, or even older persons who we really need to get to.
And lack of insight too, because sometimes persons, they see behavior. Usually if you see somebody is sad, you say, okay, the person might be depressed. But if you see anger coming out, you don't think depression. And usually when the anger comes out, something is underneath the anger, and that is the pain and that is the hurt. And persons don't realize in youth, the symptoms are different. While as in the adults, you would see the typical loss of interest in doing things they used to do before, appetite changes, sleep changes, the depressed mood and things like. In children and adolescents, you're going to see behavior issues, the acting out, not going to school. You're going to see dropping school work and things like that. And these are the symptoms that parents need to start to focus on, to let them know, hey, something is going on with this child. It's not that the child just turned rude as they might think.
Another thing is isolation. If you notice that a child used to be interactive and playful or involved in, a lot of social stuff, and then all of a sudden they're withdrawn and want to be alone, that's a red flag. Yeah? Because we are social beings, and isolation is not the norm. And so if you're a guardian, a parent, just take time and just sit and engage that individual. You'll be surprised as in terms of what they would share with you.
But we're going to take a break now, and when we come back, we're going to talk more about some of the signs and symptoms that people should look out for, and we're going to get into a deeper conversation about how some of these things can be prevented. And we're going to take your calls. So we're going to take a short break, and Working For You will be right back. My name is Jacqueline Bryan. I'm your host today, and our guests are Dr. Hazel Laws, Chief Medical Officer in the Ministry of Health, Nurse Cheryl Amory Isaac, Community Psychiatric Nurse Manager, and Dr. Sherilyn Ward Crawford, Clinical Psychologist. And we've been having a very lively conversation about how St. Kitts and Nevis has changed for young people and some of the things they have to cope with and the environment within which they exist, and even how social media that is so popular have been affecting their mental health. So we've learned a lot of interesting things, and they've given a lot of information and statistics that have brought some enlightenment to us and shed some light on the situation here in St. Kitts. Before we took the break, we spoke about some of the services available to young people, and of course adults as well. So it's not just limited to young people, but because the focus is on young people, they made it specific to that. And we spoke about how you could access these services, and it's a lot easier than I thought. A lot of them, if you think you have a situation you need someone to talk to, it's as simple as going to your nearest health center, just as if you have an accident at home and you need medical attention. So that's very encouraging, because we might have people who need assistance. So if we could just recap some of the signs and the symptoms, now that we know where the help is, let's see who needs the help, or who can we identify as needing the help.
Well, before you even go on, I said you can go to your nearest health center. But if you don't usually go to a health center but have a private doctor that you go to, just go to that doctor. All physicians can help you access the mental health services that you need.
Is that right?
Yes.
So you can go to your family doctor as well?
Of course, yes. Or he or she may be able to even help to start to deal with your issue, and if a referral is necessary, he or she would make the referral. So it's as simple as that.
So let's talk about the signs and the symptoms, because you spoke, Dr. Laws, several times before about the stigma. We know that's a very important part of this education process. Trying to get rid of the stigma that has been so hard to shake over all these years. Even though we've learned so much about mental health and mental illnesses, we still have that stigma where, as the nurse Isaac said, people say, I don't want anyone to think that my child is crazy, quote unquote crazy. And mental illness isn't just limited to walking down the streets, speaking loudly to yourself, scantily clothed, and having loud outbursts. So what are some of the things we can look for? Maybe some of the subtle signs to some of the really in-your-face signs.
Okay, you mentioned about youths talking about are so stressed out and that sort of thing. So how do we know that a young person is on the verge of like a psychotic break? All right, so there's some common presentations.
But well, firstly, I just need you to say clearly that young people can be stressed out because they are adults who say quite flatly, "You have got to be kidding me! You have everything you could possibly want. I didn't have half the things you had when you were younger. How could you be stressed?"
Yeah, because persons they come to the clinic and say, "My mother's stressing me out," and they're always on the mother case. You understand? Because they don't like to be monitored. You know, and that's one of the reasons why they said it's so stressed out, you know, so...
Not only that, to add to that too, because we have persons who are doing 12 subjects, 13 subjects, 14 subjects each, and these subjects have a lot of SBAs, and if you have to do all these preparation for all these exams, in my time was 8 subjects, you know, and was the maximum, but I'm hearing large numbers now. It could be very stressful.
They're not
so
coping.
so
stressful.
they're not sleeping.
Time management, you know, has to be on point for them to be able to do all these subjects and
not
cope
sleeping
with them.
properly, not eating properly.
So granted, there are some young people who use the word stress very loosely,
Yeah.
but then there are some who might be genuinely stressed out.
And so when a young person uses the word and you're an adult or a parent, don't take it lightly.
Right.
Listen.
That is true.
And then you then make the decision, okay, he or she is just joking. But you need to really listen and pay attention and observe to see if really this young person is in need of help.
Right.
So I don't think we should take it lightly at all.
Because when they say stress, sometimes it's not stress, you know. Because they call everything stress, but it could be they're feeling depressed.
Yes.
But they don't know the
Yes,
symptoms of
yes,
depression, but
yes.
they know they're not feeling how they're accustomed to feel. So they call it stress because everybody, I'm so stressed. I'm too blessed to be stressed, or I'm so, and stress is being up there for a while, and that is what they're familiar with. But
Some may
sometimes
say,
when
I
they
feel sad or down. Listen and observe, or pause and talk, engage that individual. Because each of us is an individual that younger person who is in need of help can turn to.
Not doing the things that they used to be interested in. I think Dr. Laws mentioned that already. You know, you like to go to play basketball or netball, and then all of a sudden what happens? You know, you're not playing basketball anymore, right? You're not playing netball anymore. You're just into yourself, right? So that's a red flag.
the lack of energy. Sometimes they complain, I don't have any energy or motivation.
Tragic.
And when we hear that, we tend to think, oh, it's physical.
Could
But
be
it's
mental.
not necessarily physical condition. It could be mental. So these things, you know, parents just can't say, okay, let me give you the multivitamins and let me give you some iron tablets that I could buy behind the counter. No, they really need to explore, listen to what's happening with the child, and seek help if necessary.
Sometimes it's poor appetite or just a sudden loss of appetite, and it may not be any other physical reason for that, or overeating,
Right.
and again no other physical reason for same. Just irritability and very angry without anything causing that you notice causing the anger. And so these are red flags that you look out for in younger persons.
And that might be something that we might just pass off as being rude.
Yeah, but yeah.
Or you might see them start to avoid friends and family. And maybe because sometimes there's so much in their rooms on the internet doing something, you know, you're accustomed to be by themselves, but you don't. Sometimes parents didn't realize, okay, something more is going on. They're not just inside there by themselves being on the internet. They might be inside there crying. They might be inside there just feeling sad and down. Okay, so we really have to look into when we start to see them being by themselves, isolating themselves. We have to look into that.
And so even though this program may be just speaking to young persons, we are really speaking to the parents of these young persons and the relatives and friends of these younger persons, because you're the ones who will notice the change and they're crying out for help, and you may be the one who is instrumental in helping them get the help that they need. Yeah.
So are there any other signs that we can look for? Maybe something more obvious now.
You know, some children who have come to the clinic, you know, they will say that, well, my heart is racing. You know,
Okay.
I feel
Anxious.
anxious. So the fearful, you know. So when they started talking, we're saying that they're displaying anxiety symptoms. They feel excited for no reason. Something like that, you know. So these are some of the red flags that we have to pick.
And
up.
that's a good point, because sometimes the teachers in school too, during exam times, you may have a student or two who you would say they're not good with exams. They get
Right.
extremely anxious. Sometimes those students are in need of help or actual treatment for anxiety.
That's right.
Yeah, and so it may come to the fore during school and during the exam time period. And so teachers need to be vigilant too regarding students who are extremely anxious on the exam circumstances, and that's when anxiety may come to the fore.
And if there's anyone, now that we're at this stage, who has a question about mental health, mental illness, or anything related to that topic, feel free to call. The numbers are locally. You can dial 465-2555. That's 465-2555. And if you're calling from abroad, you can dial 718-577-2916. That's 718-577-2916, and they're here. They're ready to take your calls and answer any questions you might have about mental illness. And if there's any myths you want busted or confirmed, you can use the opportunity to do that as well. So, what are some of the barriers then? We know the causes. We have all of these services. What's happening? What are some of the barriers preventing young people from accessing the care they need? Is it just stigma?
I think one of the things that could act as a barrier too is the distrust that persons have, because sometimes you have to come and bring your family. Just imagine a youth, you have to bring your family business sometimes to the counselor, to the psychologist, and sometimes parents tell the children what happens in the house stays in the house. So the distrust they might have that if I bring it to you, you know, you're going to put it out there, or my family is going to become aware and I may get punished. That could act as a barrier for persons to access the service.
Not only their families, Dr. Crawford, but your friends.
Of course.
You know, the friends will tease them. You know,
yes.
you're seeing a crazy doctor or something like that. You know, so that's one of the barriers for them accessing.
Are there things you do to try and allay the fears of people who might think that they can't trust the system or the counselors or the nurses?
The relationship that you have with the person, the client or the patient is very, very important. That therapeutic relationship that you have with them is going to build over time, and every time you have a consult, you know, because you're so compassionate, so empathetic, all the good qualities of a counselor, a therapist, you know, the person, these fears tend to decrease more and more.
And as you communicate too with them, you know, about the process and you know what's happening, and you reassure them, it helps. It helps to build that needed trust.
And I'm assuming that this is done in a very discreet way, so it's not easy to say that that's where she or he is going and that's what they're going to do.
Of course, it's confidential, you know. Counseling is confidential, and counselors and therapists, they don't talk about what's happening with the patients. They didn't discuss, even if this patient was came from a school, referred from a school, we don't call back the school and say this is what is happening or anything like that. Okay, it's all kept confidential. So, and when they come, we try not to let them see each other, because sometimes we have students coming at the same time, so we let them enter one way and they leave through a different door, because we don't like them to cross at all. However, sometimes what we have happening, sometimes the very students, they discuss with each other in their classroom. Okay, I'm going up by Crawford, and they say, I'm going by Crawford too. And then they come in the office, no. I don't know, but they're the ones, sometimes they discuss with their good friends, or they might come and they say, but my friend is going through something too, and I wanted to come and what's not. So we work with them, but confidentiality is a must, okay?
Are there ways we can prevent mental illnesses?
Yes, there are protective factors, especially when we have youths and adults. There's things that we call protective factors, and some of these factors are having number one is self-care. We have to make sure we eat properly. Some persons, they're not eating lunch, or breakfast is a common one, barely eating lunch and things like that. Mental health and physical health, it goes hand in hand. There is no health without mental health. So if your physical health is affected, it can affect your mental health. So making sure you eat properly and on time is very good. Physical activity, very important for the mood. Okay, it helps you to feel better. So it's a protective factor.
And rest.
Sleep is very important. If persons don't sleep for 3 days,
No, they can't function.
you just can't function. And I don't know if anybody ever didn't get a good night's sleep and they realize they're unsteady, then they're blurry, they're not thinking straight, they're distracted and things like that. So sleep, very important. And another thing is connectedness.
Yes.
Connecting
Social
with
support.
people. And we're not talking about the social media per se.
No. Just
Okay?
family, friends, loved ones.
Friends. So all these different groups that we have in community that you can connect with. We have sports. They have a football thing on Saturdays. You could go play that.
Pathfinders.
We have the Pathfinders.
4-H club.
Brownies,
Yes.
the girl guides, and importantly, we have some church groups that they call youths that they meet on Fridays. You go and you interact and you cater for your spiritual being, because we're not just a physical or mental being.
We are
we're
social beings.
social being, we are spiritual being. Okay, so we have to cater for all the different beings we have.
So as
just
young
to add-
persons, the self-care, very, very important.
Very important.
And so young persons believe because they are young, they are invincible, and they can, I don't know what's the word you use here, bleach. You can go like all night without sleeping. And self-care
Yeah.
is very, very
Very
important, and there's a link between your physical health and your mental
And
health.
just to add to the protective factors too, I think appropriate discipline and limit setting within the home is very important as a protective factor as well, right? A strong bond with the parent or the guardian, very strong bond with the, that's a protective factor as well.
And let me just stress on that. The literature suggests that parent-child connectedness, that interaction, that rapport between parent and child. So it could be father and child, mother and child, very, very important. It is as protective as this. Children who enjoy that, they are at the risk of their engaging in risky behaviors reduced considerably or very minimal. And so you won't find them initiating sex early. You won't find them abusing alcohol or any of the illicit drugs or in any risky behavior. So the parent-child connectedness is a significant protective factor.
Right, and it's supposed to be parent and modeling too.
Yes.
You understand? Because if you have a parent who is abusing drugs or there's domestic violence
Yeah, that's true.
in the home,
That's a problem.
That's a big problem there.
And then our youths also need to learn, so parenting again in terms of helping the younger person develop life skills. Like conflict resolution,
communication.
negotiating skills, so that when they mature into adults, they can deal with life issues and circumstances more effectively. They'll cope better, and so the risk of a mental illness would be reduced.
So in addition to parents supposed to be modeling certain specific behaviors for their children. Okay, so for example, if parents don't know how to resolve problems properly, and when there's a problem, there's just a big argument, curse words back and forth, not speaking to each other for days and living in the same home. This is what the child is learning, and might just end up imitating that type of way to resolve problems. So parents, we have to really act as models for the children. And something very important to point out too, some parents, children view their parents sometimes that, oh, mommy can't cope with it. If I had told my mommy was going to cry, and my mommy was going to do this, and my mommy was going to do that, okay, and they have this opinion, okay, my mommy cannot cope with it. And how did they arrive at that opinion? Okay? Oh, because they observe how their parents deal with situations. So parents, a lot of it, has to do with parents.
Okay, we have a call. We're gonna take this first call for today.
Yes, good afternoon, Jacqueline, and your guests there.
Hi, good afternoon.
Right, lovely program. Earlier I heard one of the guests said that drugs can affect one's mental capacity. Right? Now, I would like you to say, please, what kind of drugs can affect a person's mental status? And then the other question is that, what will happen if someone has to be anesthetized every day for a whole month?
Has to be. Could you repeat that?
If somebody takes anesthetic every day for a whole month, when you're having surgery, you have to be anesthetized and take anesthetic.
Yes.
Yeah, if someone has to take anesthetic for a whole month, if that can really mess up the person's mental mind, I will listen out here.
All right, thank you so much for your call. So the caller wants to know what kind of drugs can cause mental illnesses, and that was the first question. And what happens if you have to take anesthetics every day for an entire month? I don't know if there are conditions under which someone can be administered anesthetic every day. That's not my area, so I'm depending on you. So the health professionals to answer that one.
In terms of the first question, okay, we have certain conditions called drug-induced psychosis. Okay, and that comes about when persons take substances like marijuana that could cause a drug-induced psychosis. And by psychosis we mean the person would have had some sort of symptoms where they lose contact with reality, so they might have what we call hallucinations, where they might be hearing things, seeing things, feeling things that are not there, etc. So marijuana can cause that, and that's what we would see in our country. Cocaine can cause that too, and we even have alcohol too can cause that, because sometimes when persons who drink quite a lot of alcohol, they become dependent on the alcohol. When they are going through a withdrawal, they have these types of symptoms also. So these are the drugs that could affect, that we are seeing here in St. Kitts.
Those are the common ones. Yeah.
Can affect your mental function.
That could affect your mental function. In St. Kitts, we're talking about.
And in terms of receiving an anesthetic agent every day for a month, I'm trying to figure out under what circumstance that would arise. I can't bring such to mind at this time. That seems a bit unusual to me. Somebody requiring an anesthetic agent every day for a month.
But I don't know if the caller could call back and provide some clarity.
That seems a bit unusual to me. Yes.
Is it the person self-medicating you know,
How do they get these anesthetic
Yeah, because
agents
that's
that
to
is
that's
under
a
control?
control
substance.
That is
yeah,
under control,
you
so
know,
it's not supposed
you know,
to.
some people self-medicate, you know, to numb the sadness or whatever they're fixing. So I wonder if it's
So
in
that's
that
a bit
context.
unusual to me. It seems a bit unusual to me.
Well, if anybody else has any other questions, or if the caller wants to call back and offer some clarity on his question, the number is 465-2555. That's 465-2555. And the international number is 718-577-2916. That's 718-577-2916. So we've spoken a lot about the stigma, but we have another call. We're gonna take this call. Welcome to Working for You. Good day.
Yeah, Miss Bryant, I'm the one who called you.
Yes.
Well, when I said take anesthetic for a month, I was just question it if one has to take anesthetic for a period of time, but I only use a whole month for, let's say, a figure. Because, you know, a lot of people have cancer, and every minute you go here, well, then they have to go to take chemotherapy and disconnect therapy. So that's what I meant. I meant like then, okay, let me put it this way. What is the limit of anesthetic can one brain take, a human brain take, before they go insane?
Well, the anesthetic would be used to put someone to sleep.
Yes, and so
Yeah.
it's not really associated with mental illness or insanity. Anesthetic agents are not usually associated with mental illness and insanity.
And that's not something that would be given
So the
on
No.
an everyday basis,
No.
even if you have
So
to
the
have
anesthetic,
multiple
the
surgeries.
anesthetic will not damage your brains.
No.
Okay, that's what I wanted to know.
Okay, so no.
Because
it
when you
doesn't.
take the anesthetic, I mean, you don't know what's going on with your body.
Yes.
Because the anesthetic do what it has to do with your brain.
Well, no, the
puts
anesthetic
you to sleep.
agent, yes, it puts you to sleep, and so you are not feeling the pain that would be the surgeon, you know, would be the incision, etc. But it doesn't cause mental
Okay.
illness.
I'll listen up here. Thank you.
Okay, thank you so much.
Yeah, okay.
So at least even if someone has to have multiple surgeries, they would schedule them in such a way that the person has a certain amount of time to recover to some extent from
Yes,
one.
but there's
Be a
no
daily
link with
basis,
mental illness.
So it doesn't necessarily affect your brain.
No,
It goes to
no,
like asleep.
no.
I'm happy that we were able to
clarify that.
I'm happy he
Yes,
was able to
yes,
call back
yeah.
and let us get that clarified. We had said some things earlier about how we could address the stigma before. With
But
the-
we could expound a little
Yes.
bit if you don't mind. It's important for programs like this. I am very appreciative for the opportunity to even discuss even a little bit the stigma associated with mental illness, and just to stress that it's important to for persons, if you are in company with someone and a negative statement is passed about someone and a mental illness, use it as an opportunity to educate the individual and say, look, a mental illness is like another illness. There shouldn't be any disgrace or associated with such a condition. Yeah, so there should be equality in terms of the medical conditions, and you shouldn't look down upon somebody with a mental illness. And so each time as a negative statement is made about it, use it as an education opportunity, just to enlighten the person about that. And even in our regular talks, we need to be careful about the adjectives we use. For example, we may be walking down the road and say, "Oh, you're crazy," just for the fun of it. And so, which for me, I try to eliminate that from my language, using words that are associated with mental illness out of jest. Yeah, so we need to be careful of our language and be empathetic, show compassion to persons who are impacted by mental illness. These are some of the ways in which we can continue to help reduce stigma associated with mental disease.
And simple things like avoiding the labels and things
Yeah,
like that.
the labels.
Because sometimes you have somebody in the community who might have a mental illness, and instead of saying, okay, Jane who lives up the street, we might say, crazy Jane, you.
Yeah,
or
so
some
they-
sort of thing.
adjectives,
So we
yeah, not using
really
those
try,
adjectives,
you know,
yeah.
avoid the adjectives and be careful with the labels that we use when we are talking about persons. And something else people can do too is join with support groups or join with groups that help to bring awareness to the public about mental health and mental illness. For example, the Mental Health Association. Okay.
That's right. Give your plug. Give your plug.
Persons might think that you have to be in the mental health field.
No,
you don't have to be in the mental health field, because we have quite a lot of activities that persons who are not in the mental health field can help us to do to bring awareness to our
And
people
tell
with
them exactly
television.
how they can become involved in the
Okay.
Mental Health
So,
Association.
Easily, you can contact me at JNF Hospital. I'm the president. Or you could contact anybody who's a member of the association. We have Michelle Delacardre Blake, as I said, she's the treasurer. Miss Sam, she is the PRO. We have Zara Jacobs, she's the vice president. We have Mr. Naren Maynard, he works at probation. At social services, you can contact them, or you could go to our Facebook page saying it's Mental Health Association, and you can just send us a little message. And throughout the week of activities, we got quite a lot of response from persons showing interest in joining us, so we thank them and we welcome others to come on board.
I
Okay,
want to
so-
add
so-
also that mental illness is nothing to be ashamed of. It is something to get help for. Mental illness is nothing to be ashamed of. It's a condition that you need to just get help for.
I would have loved to believe we were at that stage already, but you're saying that we're not, so hopefully we're going to get there
Yeah,
soon.
yes.
So at the
because
end-
opportunities like this, as we are collectively raising our voices against stigma, and we just need to do more of this.
And we need to recognize that at the end of the day, there are people who just need help,
Yeah,
regardless
that is
of-
true.
of what help it
Yeah.
is. It's not for us to judge it, but they need help. You get them the required help. It's just like the same way if I see somebody, they have a rash on their arm, I say that doesn't look right, you should go to a doctor for that. It's the same way if I see
Yes.
someone with the symptoms you described earlier, I say,
Help channel
that
them
doesn't
to
look
help.
right.
Yeah,
They need a
yeah.
doctor. The important thing is that we get people the help that they need.
That is truly important.
So what is
so we
yes,
need,
Nurse
so, we
Isaac.
need, so we need to initiate prevention programs.
Yes.
All right. Dr. Crawford talked about the interministerial departments coming together,
That's very important.
collaboration, and the sort of
Very
things. So
important.
we need to initiate prevention programs. Like it could be school-based, at the community level, and within the ministries, education and health. Ministry of Health and Ministry of Education can collaborate.
And Ministry of Youth and Culture.
and youth
Yeah.
and culture.
Because we
Right, and we can,
targeting the
right.
younger person.
Yeah.
So we can
Yes.
come together and come up with some kind of prevention program, maybe after school parenting program, where the parents would come with the children and we interact for probably an hour, that would be so good, right? Because I don't think the parents have the skills and the knowledge to pick up all these red flags that we were talking about, all right? So that's one of the prevention programs.
And that's a good point, because I just want to highlight the importance of the Ministry of Youth and Culture, because you realize that the younger persons who are involved in football clubs, cricket clubs, netball clubs, such younger persons, the risk of their developing a mental condition is reduced. Because to play football is a discipline, you have to
That's
keep
right.
up with your exercise. They run and they exercise, and as you just mentioned, exercise helps you to feel good, and they have to eat right, and they know when they have to get their rest, etc., to go back on the football field for the 90 minutes. And so involvement in physical activity, involvement in different sporting events and clubs helps the younger person to maintain good mental health.
So
Yeah.
that
So you're talking prevention programs, but
Yes.
even that, promoting the sporting,
Yes,
activities is a means of promoting good mental health for our younger
Because as we said
persons.
before, these are protective factors,
Yes,
and
they
if we
are
have these
protective.
in place, then it would help persons not to develop the illness. So less risk for the
of
illness.
developing mental illness.
But that leads so nicely into this question about what is being done at the Ministry of Health to strengthen our mental health services.
Okay. Everybody's looking at me.
Pretty much has Dr. Law all over it.
Alright, so at the Ministry of Health level, we are looking at the cadre of persons in the mental health team, and we want to expand that cadre in terms of recruiting, for example, a psychiatrist. I think we are in need of a psychiatrist, and we need more mental health psychiatric nurses. And then you would have more persons working at the community-based level, and you will have more persons working at the hospital-based levels. Yes, okay. I hear that.
More psychologists, okay. And if we could get persons who specialize in child and adolescents, that
yes,
would be
yes,
a key,
yes,
or
yes.
maybe drug, substances.
But
like
as you said
would
that
be a key
with coming out of the chronic kidney disease program, we have the facility whereby we could request a volunteer from Taiwan, and I asked for someone to help us to develop our substance dependence program, and I was told recently that we are successful and that member of staff should be joining us shortly. So that's good. So in other words, we would be able to offer more in terms of helping persons to overcome substance dependence. Yes. And then again at the Ministry of Health level, we want to integrate mental health care into primary health care. In terms of what does that really mean? That means that you can, in the future, within in the short to intermediate term, we want to be able to strengthen the capacity of the district medical officers and the community nurses in terms of offering care to persons with mental illnesses. And so persons would then be able to walk in not just to Bastille, Molyneux and Sandy Point, but to all the health centers and access mental health care. Yeah? So that's what I mean when I say integrating mental health care into primary care. And so that's where we want to go. Pan American Health Organization is working closely with us. There is the MHGAP program. That model we will be adopting to help us to achieve this.
And what's that program about?
It's a program whereby we will be scaling up the services offered in each health center, whereby the district medical officers and the community nurses can manage a case of depression. If somebody who feels depressed walks into Tabernacle or Diet Bay Health Center or St. Paul's Health Center, the team right there on the ground will be able to provide care to that individual who is impacted by depression or even suicide or substance use and dependence.
We can train them to screen, do a lot of screening of those clients who are coming in. Just picking up little indicators of depression per se, right? And so the community care health workers could be trained in picking up these depressive symptoms and referring to the district medical officer who will then
start care.
Right.
Yeah.
And in addition to, they could learn, if the nurses could learn how to offer psychological first aid too, because often we hear about medical first aid and we know the importance of applying some sort of first aid when it's a medical condition, and it's equally important for a psychological condition or psychiatric condition too, because we are saying there should not be any difference with how we treat medical patients to how we view and treat persons with mental illnesses. So they could get skills, learn the skills as to how to address some of these situations and problems, and it would help to fill the gap that we have, because more and more persons are accessing this service. So we need more and more persons to be able to provide care to the population.
But we're almost out of time, so in closing, I'll allow each of you to say your final words, your final thoughts, and some of the things you think would be really important for persons to remember after the program. So, Nurse Isaac, we can begin with you.
Okay, I would just like to say there's no good mental health without, health without good mental health. All right, and so what we were saying here for the past hour or 2 hours is to pick up the red flags, to pick up the signs and the symptoms that will help the youths to manage and to treat the youths. Right, so.
For me, mental illness is nothing to be ashamed of. It is just another condition that one needs to get help for. And in speaking specifically to our young persons, it's important as you mature, and even as I continue to mature, for us to be mentally resilient, whereby we are aware of ourselves and our emotions, and learn behaviors that can help us bounce back quickly when we've experienced hard knocks in life.
Okay. There's a saying that old persons used to say, an ounce of prevention is better than a pound of cure. So what I would really like persons to take away from today is the protective factors. Really tap into these factors that helps to prevent mental illness. All the social connectedness, all that nutrition and self-care that we spoke about, it is very, very important if we want to have mental health. So really focus on these things. The exercise that we spoke about, all these things that we discussed that has to do with the protective factors. Really tap into them and, decrease the risk for mental illness.
Well, thank you all so much for coming on the program today. I really enjoyed the discussion, and I enjoyed learning about how young people are affected, what the signs and symptoms are, and how we can help them. I think at the end of the day, that's most important. If we better understand what we're dealing with, then we can have a better appreciation for it, and we can reduce the stigma moving forward and just get people the help that they need and deserve. So that wraps up today's Working For You program. I want to also thank all the persons who were listening via our Facebook page online, or a radio station online, or the radio, because it airs live on ZSN and partner radio stations every Thursday at 1 p.m. My name is Jacqueline Bryan. I was your host for today. And thank you to our caller. We had another caller, but we lost the caller. Hopefully, if you need any additional information, you can contact the Ministry of Health, because there's always someone there who can assist you with any questions you might have. So feel free to contact the Ministry of Health if you didn't want to call in on the radio program live. This is a very important topic, and the conversation about mental health and mental illness does not stop here. It can continue after today. So thank you so much. Enjoy the rest of your day.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.